So what's the council doing and how's it trying to get there? Well, I took over the role of the Executive Councillor for Adults, Social Care and Supporting People about 5 years ago now, and we were quite clearly at that stage well embedded on the process of going down putting people first, which was the government initiative about actually asking people what they want and the personalisation agenda. There was a lot of work done, lots of consultations. In fact, when I first got involved with this, after the first 6 months, my wife said to me, I think you better put your bed in the council because I never see you. And I think we consulted to death. Everybody and anybody that could have a voice, we tried to listen to. And the fact that we did that, I think, really helped me to understand what people who receive services and what carers want. And then if you take the other perspective, it's how much our society prepared to support those wishes. And that's the balancing act for a politician. It's how much resources do we put into adult social care, against how much do we put into schools, against how much do we put into libraries, and how much do we put into roads. And it's a real fine balancing act to satisfy all the different sectors that have an interest. And I think it's fair to say that I've yet to meet any politician of any colour who's achieved that, because no matter what you do, you're always wrong. And if you start off with that perspective, if you start off with that, was that boring? If you start off with that perspective, you're never disappointed. So what did we do in Lincolnshire? After the consultation, we had a look at how we were providing services and how did they match up against what people told us. Quite clearly, when this system was first set up, it was very prescriptive. You know, you need services, fine. I'm the professional. I'll tell you what you can have. And some people that was fine, and other people it wasn't for them, and they went off, did their own thing, and didn't get the council support. When we started to change that, so people actually were assessed, and we started to have this magical thing called personal budgets, some of the people who hadn't been engaged with us before suddenly came back and said, oh, I quite like this idea, and I've got these needs, and if you assess me, I can prove it, and I'll have my budget, thank you. And that was a bit of a shock for Lincolnshire, because we suddenly got this extra demand from people who quite rightly said that the support's there, you're going to give us the money, we'll take the money, but we'll do our own support. And I think since that concept has taken root, and since a lot of people in here, and I'm sure there's lots of people in here who've got a personal budget, are actually taking their budget, there is no doubt in my mind that the people who need services and the carers, people involved close to those two groups, know exactly what you need to make your life better. And it may be something totally different to what the able-bodied person or the person in the street may think. And we have some quite innovative things going forward. And I'll repeat this because it's such a good one for me, about somebody that came, a lady had come, and her husband had got dementia, and her son had autism. He liked to go and visit the places they'd been to, because that kicked in with him and that helped him along. The son liked to drive in the car, but every time it stopped, he couldn't stand it, playing on the street, kicking, shouting. She couldn't remember always the places they'd been, and she couldn't stop to read the map because sun played on. So she spent her personal allowance on a sat nav. So she would put in where she wanted to go, she would drive there nice and comfortably, husband was happy, son was happy, wonderful solution. When this first got moved in the council, I think it was somewhere close between being the target or being the leper. Because it wasn't to be accepted that people could make those sort of decisions and spend public money in that way. And I think now that the concept and the understanding is spreading, I think there is far more content within the councillors who ultimately make the decisions, the vote where the money go. That the personalisation agenda, what we've been trying to follow in Lincolnshire, is actually the right and the proper way to go to give the services that people want. We also looked at the services that Lincolnshire provided, and I know this will be a bone of contention for many, and I make no excuse for it, but we looked at things like the in-house care homes are in-house provision. Were they the right thing? Were we doing the right thing? How did they stack up against what the private sector and the voluntary sector were doing? And quite honestly, I was quite disappointed. Not that the standard of care and the quality of care that we provided to the council wasn't good, it was excellent. But in fairness, it was too excellent. It cost too much money. So there are lots of issues about closing our care homes, and that decision has been taken, was taken in January. The 8 homes that we have left, 5 of them will close before in September this year, and the remaining 3 will close when we're satisfied we've got the services in place to provide the services that those 3 remaining homes have. We also looked at the eligibility criteria, and I know that from some of the faces here we had some quite robust discussions, and I think that that was an absolutely really good piece of work that we undertook, because it actually brought people out who we didn't engage with before and says, but what if? And I think it's fair to say that we were going to take the paper before the executive in July to decide whether we were going to reduce our eligibility criteria, but because there's been such a response, and because I really do think it's important that councillors need to understand what that consultation said and what the ramifications will be on services and on cost, that we're not going to take that paper, we're not going to discuss it until October, and that will give us more time to look at it. Some of the things that we're looking at and trying to develop to spread this out is about how we spend the £9.1 billion that Health was given as additional money this year to work with adult social cares, to see how that money will be spent. And I know that that was finalised about a fortnight ago, and a great deal of that money will be spent in preventative work, enabling people to remain independent longer. And if we do have to change, and I stress that if we do have to change the eligibility criteria, some of that money will go in to support people whose services, as they receive them now, may change and differ. So that's where we are with that. It was very interesting to hear the comment here that expensive services don't mean good services. And another thing that we've done in Lincolnshire is we've taken a real close look at all the more expensive packages and see how we can look at those packages and could they be done in a different way at a far more economical manner. And as a result of that, some of those most expensive packages were children coming through with a learning disability into adulthood, and so we set up a department which was the transitions, where we looked at every child so that we can map every child that's coming along that we know has got a physical or a learning disability that potentially could have some real serious impact on the finances. But some of these packages were in excess of £200,000 a year, and we looked at the way that we can work with the families, with the service providers to reduce costs. And can I just say that when we're reducing costs, it's not about saving money, it's about releasing money to put into more services. And apart from having the budget cut that we have, adult social care doesn't make savings that we take the money and spend it elsewhere, we reinvest it in the services side. Another, I think, a real success story for Lincolnshire, and it's nice to see that the Carers Partnership here today, is the way that the carers were acknowledged some time ago, and that we actually work with the youth carers and the Carers Partnership, recognising that the valuable work that carers do, and the fact that carers work with the ones that they work with because they want to, because they love them, because they're family, and that relationship between the service user and the carer is vital for good quality of life. We've had to make some adjustments because of the way that we're looking at what the council does things, but the budget for the carers, we made a conscious decision would not be touched, and as a result that same amount of money is running to the carers. I can't announce anything yet, but I'm quite hopeful that there'll be some substantial monies released after the council's meeting in July to bolster up and support the Carers Partnership. That in a nutshell is basically what we're doing. We're looking, and we will continue to look at the type of services that people need and the way that we can enhance and improve those services. One of the last things I'll say is that the personal budgets and the way we've gone forward with those, one of the biggest challenges that I think the council has faced and the community is facing is ensuring that when personal budgets kick in, that there are the services there that A, people want, and B, that they can afford them. And one of the hardest things we're having to do at the minute is stimulate the market to make sure that the service providers have the confidence that their services will be taken up. Because it's a very expensive thing to set up new types of service and then just to sit there with your fingers crossed, hoping that people with a budget will come and buy the services from you. It's a real challenge, but I believe that in the very near future there'll be a lot more services come on board. As you all know, the government target is that everyone will have a personal budget by 2013, will mean that there's a lot more people out there making choices. I think the council's role for the future will be commissioning and care and assessment management. And I think that is where the council's strength should be. Listening to what people say, commissioning the right services in the right place, getting the value for the money, and supporting people for them to have the freedom to make the choices and to take control of their own lives. Thank you very much.